Hi, I'm Dr. Samuel Kim. I am a plastic surgeon and a hand surgeon at New York Plastic Surgical Group. So in my practice, I see patients in Columbus Circle, New York City, in Englewood, New Jersey, and Garden City, New York. I had quite a roundabout route to plastic surgery. I tried other things. I originally thought I wanted to be an interventional radiologist, but the more I started to use my hands, the more I wanted to do surgery. So I've been a practicing physician for 12 years now. When patients see me for their first consultation, I do understand that it's a situation that can be stressful. My approach to patient care is to take a very patient-centered approach. I like to find out as much as possible what the goals of the patient are. It helps me understand a lot more about the patient and what they desire when they come see me for surgical consultations. So I was born in New York, but raised most of my life in New Jersey. I find it very exciting that I get to practice in New Jersey again, and essentially go back to the community that I grew up in and to serve that community. I realized that I wanted to pursue hand during my residency training. I wanted to make sure that when I left my training that I could handle anything in plastic surgery. To pursue excellence, to pursue the peak of plastic surgery, that for me was to pursue an additional fellowship in hand surgery so I can truly become an expert in that. It does take an extra year of training to delay the career that I ultimately am seeking, but I don't regret that for 1 second, because I feel like that I came out truly well versed in all things hand surgery, and I am truly confident that I have the ability to help these patients no matter who comes through the door. I realized that medicine, and then eventually plastic surgery, was in my first year of residency outside of medical school. I did my first year of residency in general surgery to prepare for my eventual specialty in radiology. And that's the first real experience I had in the operating room where I was the one who was primarily operating. I have a brother that I'm very close with, and he asked me very straight up, if you could do anything in your life, you could pick any specialty now that you invested in medicine, what would you do? And I told him flat out, probably plastic surgery. About 3 months later, I announced to my program in radiology that I was quitting. And that led to entering into a plastic surgery residency and being a plastic surgeon today. I would say one of my favorite cases that I get to do is a rhinoplasty, or commonly known as a nose job. I think it combines a lot of aspects of plastic surgery. It's truly craftsmanship. It's very difficult surgery, but when patients are happy, it really makes you happy that you've helped someone to be more confident about their lives. The challenge is what makes plastic surgery exciting. So the more challenging it is, the more gratifying the result. The goals of rhinoplasty are generally twofold. There's the cosmetic aspect of it, but there's also the functional aspect. And this, I would think, rings true for all of plastic surgery, where we both look at both form and function. So you want a great result, meaning you want a nose that fits your goals. You want a natural looking result, but at the same time, the nose's primary function also is to help you breathe. There are different goals for patients depending on their ethnicity, and every ethnicity tends to have different goals. So for instance, in Korean rhinoplasty, many patients who seek rhinoplasty want a raised dorsum or raised nose profile that requires different skill sets, different techniques to help achieve their ideal outcome. Lower blepharoplasty is a great option for patients in their 20s and 30s. In fact, in Korea, it is the second most popular cosmetic procedure performed, next to an upper blepharoplasty, which is a topic for another day. Many people think that under eye bags is just simply a sign of aging, but there is a genetic component to it as well. Patients maybe are young, but they just simply have under eye bags that make them look tired. They are trying to look more refreshed. They don't want people to ask them, did you sleep when they had great sleep? So they just want to look more energetic in front of their friends and their family. So for patients who want to look more refreshed, a lower blepharoplasty procedure is a great option. It's a procedure that many times can be performed without any external scar, so no one knows you've had surgery, but many friends and family will come up to you and say, hey, you look more energetic today. That's the goal of blepharoplasty. Some of the most grateful patients that I've had that came for follow-up are those that underwent breast reductions. Breast reductions, commonly people think is just simply a cosmetic procedure, but it can very commonly be an insurance-based procedure that deals with not only the cosmetic result of a breast, but truly fulfills a goal of easing a patient's pain that they present with. I love all aspects of plastic surgery, both the good and the bad, because I do know at the end of the day, our whole purpose is to restore form, restore function to all these patients, and many times we can even bring them to a point that's better than what they even started off with. This means something. It's exciting to take care of patients, to make them feel better. It's gratifying for patients to come up to you crying or smiling, thanking you for the care that you provided them. They're truly thankful. That makes me so invested in my profession.